Hello, my name is Michael Phillip, and I'm a physical therapist, and today we're going to be covering the topic of foot drop. Foot drop is not a disease itself, but rather a symptom of various neurological, anatomical, or muscular conditions. Patients who suffer from foot drop typically have a difficult time lifting the front part of the foot off the floor as they walk due to paralysis and weakness. Sometimes they even drag their foot, which can present as a tripping or a falling hazard. Common reasons patients present with foot drop include stroke, spinal cord injury, or injury to the peroneal nerve on the outside of the fibula just below the knee. Some reasons for injury to this nerve could be a knee replacement, blunt force trauma to the area, or lacerations from sharp objects. Other reasons are ALS, which is Lou Gehrig's disease, Parkinson's disease, or multiple sclerosis. Foot drop is caused by one of those things limiting or stopping the signal to your tibialis anterior muscle that runs along your shin. This muscle is the primary muscle for lifting your foot up off the floor as we walk so we can clear the floor as we swing our leg through to take the next step. The first step in treatment is determining the cause of foot drop in each patient. Depending on the cause of foot drop, it may or may not be cured. Foot drop caused by trauma and or nerve damage has the potential for partial and or in some cases complete recovery. Foot drop caused by neurological disorders will not be cured, and rather it will be a lifelong symptom that patients can learn to manage through exercise and modalities through their physical therapist. The goal of treating foot drop with physical therapy is to get the patients back to a regular gait cycle by retraining and strengthening their muscles. And in some cases, where falls are more likely, or in those cases of a neurological disorder causing the foot drop, an ankle foot orthotic, or AFO, may be necessary. This is a device worn by the patient that holds their foot up, thus preventing them from dragging or causing the telltale sign of foot drop, the foot slap. Foot slap occurs when the heel hits the ground, and because you are unable to control the descent of your foot, it creates a slapping sound or feeling of the foot against the ground. Strengthening and AFOs are just two of the three main treatments for foot drop. Electrical stimulation is the third. With neuromuscular electric stimulation, or NMES, the anterior tibialis muscle is directly stimulated. This helps the nerves fire, making the muscles contract. Over time, the idea is that the leg muscles will be retrained. Clinicians start using NMES with patients in a resting position so they can get used to it. Later, patients walk on a flat surface as the physical therapist controls the NMES, pulling their foot upward when the muscle is stimulated and dropping it back down during the off portion of their gait cycle. All of the treatments for foot drop are simply tools for the patient to improve mobility and decrease the risk for falls by tripping over their toes or foot. If you suspect you or someone you know has foot drop, they should go see their doctor if they haven't already. And then they should see their physical therapist, who will come up with an individualized treatment plan to get them back to normal or reduce the effects of this condition. And that's all I got for you today on foot drop. So I hope you learned a lot and enjoyed today's session, and we'll see you again next time.